Hi all. Thanks all for joining us today to learn more about this opportunity for this mouthful of a title, funding and technical assistance to reduce housing instability for families at high risk of child welfare involvement in Alaska, Minnesota, Washington, and Wisconsin. Such a mouthful. The purpose of today's webinar is to go over the RFP and any questions that you may have about the process. And we're just so happy that you all are here and that you're joining us today. Next slide. And really quickly, we're recording the session so that folks can access it later. And we're also transcribing with AI. I think there was just something that popped up. So just so that you're all aware of that. Real quick, my name is Stephanie Cabrera. I use she and her pronouns. I'm a senior program manager with the Corporation for Supportive Housing, and I'm located in Vancouver, Washington. And I'm joined today by my colleagues, Amy Stetzel and Teresa Tenori. I don't know if y'all want to pop off, or pop on, but no pressure to do that. But please feel free to introduce yourselves in the chat, just your name, where you're joining us from, and any questions that you may have that we could answer towards the end. But we're, super happy that you're here. Next slide, please. So today's agenda, we're going to quickly go over a little background on CSH. I'm going to offer a quick summary on what this opportunity is. We'll go over the need for supportive housing for families and youth, and then we'll jump right into the RFP and any questions that you may have. So it'll be a little bit of info before we jump into the RFP. Next slide. Thank you. So many, if not most of you, are likely familiar with CSH or the Corporation for Supportive Housing. But we're a national nonprofit that focuses on all things housing, homelessness, and health. And we're working to advance affordable housing aligned with services as an approach to help people thrive. And we do this by advocating for effective policies and funding, for equitably investing in community, and by strengthening the supportive housing field. I'm sorry. Next slide, please. Sorry, my screen froze. Oh, there we go. So CSH envisions a just and equitable world in which all people are thriving in their homes and their lives. And through our strategic plan, we've identified housing, services, and economic security as our main focus areas to work towards these thriving communities. And we're aligning all of our work efforts to move these focus areas forward. And so you can see a little bit on the screen, but this is just a piece from our strategic plan. Thank you, Lauda. So what is supportive housing? I'm sure that many of you here know, but just in case there are some folks who may not, supportive housing is deeply affordable housing that also includes flexible, voluntary, and comprehensive services that tenants can participate in or not participate in, that works closely with property management. And the overall goal of supportive housing and of all of these service providers and working closely with property management is to support tenant stability and to promote a healthy, positive community. Supportive housing is an innovative and proven solution to some of communities' toughest problems, and it's the scaffolding for the delivery of more effective and responsive public services. So we know that it works, and we want to convince everybody else that it works. Next slide, please. All right, so we're going to quickly jump into the opportunity summary here. Next slide. There is a lot to read on this slide, and Amy will go in depth on this in a bit, but essentially CSH was awarded funding from the Margaret A. Cargill Philanthropies to partner with families, communities, and systems to transform systems, develop new and different ways to access housing and services, to promote equity and thriving for families and communities, and to reduce family separation and housing instability for families already involved or at high risk of involvement in the child welfare system. So through this process, we will select 4 applicants, and they will be from Minnesota, Wisconsin, Washington, or Alaska. And each applicant will receive up to 24 months of technical assistance, and they can request up to $100,000 in sub-grant funding. So this was just a very quick overview. Again, Amy will go in more depth later, but I'm going to hand it over to Teresa.
There we go. Okay, great. Good morning, everyone. Or yeah, it should be morning for everybody. So my name is Teresa Tenori. I'm actually based in Seattle, Washington, and I serve on the Northwest team for CSH. I'm happy you all are here to join us. So I'm going to cover a couple things that I know that are actually are in the RFP. So we're going to refer you back to the RFP quite a bit, but we wanted to spend a little bit of time just to reemphasize, why we are doing this work. What's the need? And there, again, there's quite a bit of information in the RFP, and you must, sorry, I'm getting these little pings. You all most likely see the need every day, and that's probably why what brings you here today. I'm going to touch just lightly on some key points that motivate us to be in this space and do this particular work. So next slide, please. So to start with the state of housing, many of us from CSH either come from housing, and this particular team also, we have child welfare histories with child welfare and housing. So we hear and we see the challenges around housing and across the country. Housing crosses everyone's work, whether you're working in child welfare, home and community-based services, or you're a housing provider. Stable housing matters, and the lack of the stable housing it can be a really traumatic experience for many people. Housing markets are tight. Availability is hard to come by everywhere. So we see that, we hear it. Not only the shortage impacts millions of households everywhere. I think the rental subsidies, they estimate there's not only probably enough for 1 in 5 eligible households, so there's still quite a need. Let's see what else. The wages have not kept up. We know that. So there is a crunch, definitely a crunch with housing, and child welfare has challenges as well, trying to find placements and stable housing for families. Next slide, please. This is more of the why. Why are we doing this work? Numbers are increasing. This year's HUD point in time, actually was from last year, it showed a 12% increase for homelessness. And the number of people who became newly homeless increased by 25% between 2021 and 2022. The number of families with children who are experiencing homelessness increased 16% between 22 and 2023. So these are really disheartening numbers. This slide also shows the U.S. Department of Education's McKinney-Veto's count for number of students experiencing homelessness. Also, it is an incredible number. Next slide, please. This shows some child welfare data on housing. The lack of stable housing is not a required reporting metric in AFCARS, which is the National Child Welfare Database. So we know this is an undercount because it's not really collected, but it still shows of those states that are collecting it, the pretty high numbers of families that are coming to the attention of child welfare because of housing. So that number is pretty alarming. We also know that the national data tells us about 40% of the adults currently experiencing chronic homelessness were once in foster care. So when we think about this space and this work, it's not only the current children, young adults, and families involved in child welfare, but it's also the next generation and the next generation that we can impact by doing this work today. Next slide, please. This shows disparities or disproportionality really in numbers in child welfare, but it's also evident in housing as well. And I'm going to refer you to our website because it's going to have a lot more detail than this slide. This slide just shows the disproportionate numbers compared to their general populations in the states. And CSH has done some work on really the disparities as well, including like poverty levels. We know in the 4 states that we are interested in that, for instance, in Minnesota, Native families are 36 times more likely, and Black families are 3 times more likely than other races or ethnic groups to be involved in child welfare. Wisconsin, Black and Native families are 7.2 times more likely. Alaska, Native families are also 6 times more likely to be involved in their system. So these are alarming, especially for BIPOC families. I think that's it. Next slide, please. So all this dismal information. The good news is I think you all know what needs to happen. We also know too that it is good news. I mean, we know what works to strengthen families, children, and young adults and set them on a path of stability. We know that safe, stable homes and nurturing environments for them can lead to real health, positive health, thriving individuals who are equipped to learn and to fulfill their potential. So this work does matter. And the reason for this slide is to really show that this work is connected to a national initiative called One Roof. And I put the website on there, but we could put it in the chat as well. If you haven't been to that website, it's a good one. It will also show some examples of jurisdictions that have participated in this effort previously and what they've accomplished. And lastly, I just wanted to talk about just a couple things about the cross-sector importance of this work, that this partnership between child welfare and housing, it sounds easy, but it's, we understand it's complex, it's difficult. Everybody has a lot of work to do, and the opportunity to come together cross-sector is so critical to solving a lot of these problems. And so that's the opportunity that we're excited about and want to spend time with. So that's it for me. I am sending it to, who else? Oh, I have one more, sorry. So this shows keeping families together, an overview. It's a 2-generational approach to supportive housing. And while there's more to learn, and actually it does speak to the sites that are on the One Roof. Yeah, I think that's it. Is that right? Oh,
Yep, that's right. Perfect. Thank you,
thank you.
Teresa.
Yeah.
Thank you very much. Yeah, if the One Roof, what am I trying to say? The website is in the chat. So if you all haven't checked that out, please go ahead and go. What Teresa was alluding to is I think now there's over, 10 communities who've implemented what we call a Keeping Families Together supportive housing initiative. And you can go to the One Roof site and just learn what other communities are doing. And kind of dig in and see some examples of folks doing this work in real time. So now we're going to get to the fun stuff, which is why you guys are all here, right? Which is the real nitty gritty of the RFP. So buckle your seatbelts because this is not going to be exciting. We're just going to really walk through the basics with you all and want to make sure you're super well equipped to put forward a strong application. So RFP. So the purpose of this RFP, and Stephanie and Teresa really laid strong groundwork for why we're doing this work together, but it's really about identifying, designing, and implementing service and housing strategies that are co-designed with families and communities that hit 2 objectives that we're looking for. The first objective is reducing housing instability and risk of involvement with the child welfare system. And the second objective is reducing racial disparities and disproportionalities among those families who are at that intersection of homelessness, housing instability, and child welfare involvement, with a real focus on American Indian and Alaska Native communities. So we anticipate selecting 4 applicants from the states of Alaska, Minnesota, Washington, and Wisconsin. In our dreamiest of dreams, we would love to have 1 applicant selected from each state, but we know that we're going to get a bunch of applications in from probably all of those states, and we'll be going through the application process. So we might not have a selected applicant from all 4 states. We might have 2 from Alaska and 2 from Washington, or 1 from Alaska and 2 from Minnesota and 1 from Wisconsin. It might be a mix. So please go ahead and apply if you're from one of those 4 states and are interested in this RFP and feel like you meet the objectives. So sites will receive 24 months. If you're selected, your site will receive 24 months of technical assistance provided by CSH and up to $100,000 in sub-grant funding to really support the work that you're putting forward in your proposal. So who's eligible? If you're a nonprofit organization, if you're a government entity, whether that's state, county, or city, or you're a tribal nation in Minnesota, Washington, Alaska, or Wisconsin. We really want to see applicants come in with other relevant multi-sector partners with this application. So we want to see folks partnering with, and you can see a list here. So that this is not an exhaustive list, but want to make sure we're kind of giving you some ideas of who we want to see included in your application. So folks like your public child welfare agencies, your housing authorities, your continuums of care, COCs, health behavioral health entities, supportive housing providers, in-home child and family services, family resource centers, local aid agencies, and or large-scale funding and service providers like the United Way. We also will be funding applicants who've not been awarded grants by CSH in the past, focused on better connecting child welfare involved families to housing. And only one proposal will be accepted from any one collaboration from a specific county or local region. So you might in this process find out that there's 2 folks or maybe 2 entities from I'm going to pick on Seattle, the Seattle area coming in for this funding. And so it really behooves you to talk to each other, and we'll do some kind of dating on on the back end too, or some matchmaking on the back end if we find that, oh, actually there's two nonprofits coming in from the same area of the country, to see if you all want to go in on a application together. We have preference to fund applicants who, again, really focusing heavily on that multi-sector partnership piece, and ensuring that the partnerships embed parents and families who have lived experience of child welfare involvement and homelessness. Applicants who really show a strong long-term vision and commitment to increasing housing stability for child welfare involved families after the funding ends. So are thinking already about what does this look like 5 years from now? And then prioritize disproportionately affected communities in their interventions. The focus of this RFP, the population focus, is children, youth, and families who have experienced, are currently experiencing, or at high risk of child welfare involvement, and who are experiencing homelessness or housing instability. So here's what you can expect from CSH as far as our technical assistance piece. We will be supporting convening efforts throughout the project if you're selected as an applicant. That includes really a regular meeting cadence with the 4 teams that are selected, as well as peer-to-peer learnings. We have a CSH summit that we want folks to be coming to. That'll be in Chicago in 2025. And so really wanting to spend good time with all of you, and making sure we're supporting you regularly through regular meeting cadence, as well as some of these kind of bigger peer connections that we want to make throughout the 24 months that we'll be working with you. Thinking through the development of a customized action plan about identification, unit creation, kind of referral and navigating systems, supporting the development of a tool or screening method to identify families' housing needs as a way to begin collecting data on child welfare, child protection, and housing needs. Thinking about strengthening services planning and collaboration, and or completing a data match and analysis. So really want to be there for you and supporting you in all the ways that you want to do this work that you're proposing. So what we expect from our selected applicants is, again, that commitment to implementing a multi-system collaboration, commitment to wanting to actually receive the technical assistance we'll be providing all of you for the life of the grant. So really here, I think we want to focus on making sure that if you're putting forward team members that you say are going to be part of your core team, we want to really emphasize that our expectation is that they'll be at those meetings regularly as much as they can. We know people are busy, but really carving out and making this a priority and a time priority for the people that you want to be part of that core multi-sector team. The inclusion of families, parents, and children or youth with lived experience in your leadership and your core team and who you're engaging as you're talking about how you want to do this work. And then again, project teams must be willing to meet with CSH over the entire course of the grant. So as I said before, grantees are folks that we choose as applicants will be eligible to receive up to $100,000 in funding. There is a 10% cap on indirect administrative expenses as per our funder, but otherwise you really have the flexibility to use that money in the ways you see best to advance the project that you're putting forward. And again, just want to highlight that folks with lived experience, our expectation is that they'll be financially supported throughout as part of your budget as well that you put forward. Here are some of our key dates. So RFP was released on January 17th. You all are here with us today. It's February 2nd. If you don't know that, it's February 2nd. On the 16th, that's our deadline for questions. So ask questions today. Keep the questions coming at us. I'll tell you where to send those questions in a little bit here. But the deadline for when we're going to be receiving questions is the 16th of February, and we'll make sure to make all of your questions and the answers to those questions public on the RFP landing page that we'll put a link to in the chat. I'm sure all of you have already been there, but we want to make sure you know where to go and find those answers to those questions. The full proposal is due the 23rd of February. And then we will be, CSH will be reviewing those proposals. We'll be doing a final interview round March 11th through 15th. And then we're anticipating to announce our awards the week of April 22nd. Here's some more about the question and answer period. So again, this oneroof@csh.org, you're going to see this email a handful of times in the upcoming slides. Send your questions here by February 16th. So here's your full proposals must do, right? It's due, basically due, it's not basically due, it is due February 23rd by 5 p.m. Central Time, 3 p.m. Pacific Time. Submit your full proposal to, here's that One Roof email again, oneroof@csh.org. All your proposals need to be submitted electronically in Microsoft Word or PDF format, including all your attachments, okay? Here's what a full proposal must include. A complete application, which is, we know it as Appendix A of the RFP. Again, on the landing page, you can find all of these are clearly marked there. So Appendix A is the application. Appendix B is our budget request template. So that also needs to be completed. And then these attachments must also be included in to be considered a full proposal. Letters of commitment from sector leaders, those are folks who can make those really key budget, staffing, and data decisions that are going to be on your team. Letters of commitment from the organizations that are providing the on-the-ground staff for this proposed work, saying like, yep, we're all in on this. We're going to make sure our staff have time and are prioritizing this work over the next 2 years. Release statement of intent detailing how families with lived experience of child welfare involvement and homelessness will be incorporated into the design, planning, implementation, and long-term stability of the proposed intervention. Um, the proposed project budget, which is the actual budget request template, so that's its own thing. Lead applicant financial statements for the current year that are unaudited, plus 2 prior years of audited financial statements need to be attached to your proposal. And then a list of your board of directors from the lead applicant agency. So those 3 things: full application, which is Appendix A, a filled out budget request template, which is Appendix B of the RFP, and then this list of attachments must come in by February 23rd for your proposal to be considered complete. So after we get all those, we'll be convening a scoring committee, which is going to be tasked with scoring all these great proposals that we're getting from all of you. And so we'll be, of course, looking at eligibility, interest in serving the population focus, intent to commit the appropriate level of capacity needed to actually do the work, and the overall level of readiness for doing what you propose. I also want to give you some more detail on specifics of what we're looking for, so you can have, this is us being as transparent as possible of what we're looking for. A lot of these we've already talked about, but really, what problems are you trying to solve that align with the objectives of this RFP? That multi-sector collaboration, really be clear on that. Inclusion of child welfare, housing, and service sector leadership, and active and anticipated engagement. Inclusion of families, parents, and children and youth with lived experience, both in your leadership on your core team and as part of who you engage to think through what you want to be doing, the work you want to be doing. Kind of that overall readiness piece to actually do the work, service and provider capacity, plans for long-term sustainability or what you anticipate you'll be needing for long-term sustainability, strategic use of data in targeting the planning and implementation of the work, how you anticipate program evaluation will be used to change course and scale the work, how you're going to use what you've got available already, and maybe propose new ways to use what you have available already to overcome barriers to get more resources. And then that thinking through that approximate budget, that Appendix B, that reflects to the anticipated staffing and time to complete the proposed work. Oops, I went a little too fast, guys, sorry. So your next steps, I'm sure you all have probably already taken a scan at the RFP, but really review the RFP. There's lots of good information in there. And we've tried to put as much resources in there as we possibly could. So really take a look at that and read through it. Really, if you haven't already, identify and recruit your multi-sector team members and partners who you think need to be a part of this. Ask us any questions you've got by February 16th, and then visit the landing page for the RFP for updates on the questions you've asked and questions anybody else has asked too. Submit your application by February 23rd, and then we'll be reviewing from the 23rd until around March 11th. We'll probably be doing some interviews with finalists the week of March 11th to March 15th. So that's our timeline, and then with applicants being publicly announced right around April 20th timeline. So that's really the overview of everything, everyone. Do folks have questions now that we can answer now? Or if you think of something later, obviously, again, send it to us and we'll make sure we answer it as soon as we can. If selected, when does the grant period start? That is a great question. Carol, hello, Carol. So we anticipate let's see, I've got to look at my timeline because we kind of have this laid out too. We anticipate a formal announcement of, let's see, hang on here. Formal announcement of applicants, I think it's April 22nd is what we said or what we're anticipating. And then the actual work, let's see, we really want to begin as soon as possible after that. So I would say in May. I'm going to look to other team members here uh, for some, if anybody wants to jump in with some other clarity, but our aim is to start the work as quickly after winners are announced as winners, grantees are announced as possible. Hey, Jessica, this is a great question. I'm going to read it out loud. If an agency serves more than one area or county within the state, can one agency submit more than one application? That is a great question. My sense, we might have to come back to you on that one. If Andrew or others want to jump in on that.
Sorry.
Yep.
Hi, everyone. Andrew Johnson with CSH. My recommendation in that kind of a scenario would be to think about one application that encompassed, if there's a couple of different service areas or, multiple regions with one agency, consider if you can have one application that would kind of encompass those areas.
Hi, Gloria. Good question. Gloria asked, does the project have to focus on American Indian Alaska Natives as the target population? The answer is no. We know that American Indian Alaska Natives have a high disproportionality of child welfare involvement and homelessness throughout the nation, and particularly all 4 states. We do want to ensure that the initiative you are putting forward takes into account the disproportionalities you are seeing in your state or a region and are addressing those. So it does not have to focus on American Indian Alaska Natives, but it does need to address disproportionalities that you are seeing. Allison Moon asks, is the 100,000 subgrant for the full 24-month period, or is that an annual amount? That is for the full 24-month period. Great questions, everybody. I'm looking at my other CSHers. If there's anything that I missed or you want to clarify about the RFP, please jump in. Otherwise, I think we might just kind of hang out a little bit if people have more questions. Okay, here's some more coming in. Good. Allison Moon asked, does the proposed project have to be something new, or can it be an update of work that is already underway? That is a great question, Allison. And I think we were actually talking about this question. I think you might have submitted it before this webinar. So thank you for asking that. I'm going to have Andrew Johnson weigh in on this one as well. But I think something that we were talking about right before this webinar started, is that we know that our child welfare systems, our homeless systems, are not new systems. And so I think the main thing that we want to see here is that anything that you're proposing is about doing something different that increases access to housing and services that that better connect child welfare involved or families at risk of child welfare involvement to stability that they need to stay out of the child welfare system. But Andrew, you might want to supplement that.
Yeah, I think that's exactly right. I would just add that, you know, we're certainly looking to you all as applicants to propose, you know, you have the best lens on your states or geographies to be able to propose something that is going to create that impact, right, and that value. The idea is not for this funding and support to be for business as usual or, you know, kind of continued existing operations. It's really focused on moving this multi-sector team of folks in the defined geography from, you know, where you are to where you're envisioning you need to be to allow you to, you know, further test or expand scope and scale to shift some of the systemic components, the practice components, the partnership elements, et cetera, that can allow ultimately children, youth, and families to have more equitable and more equitable outcomes and really move to that place of truly thriving. And so I think there's a lot of ways that can look, but certainly it is not intended, you know, kind of for just operational continued funding or something. But yeah, everybody's going to have different starting points or building blocks, you know, things to build from, things to enhance, things to expand in different ways, things to move from pilot to like, how do we really bring this into how we do business now more universally? Or there's a lot of different ways you can think about that. So I think we're trying to leave enough room for you all who are the, you know, really the experts of your geographies to propose something meaningful and something that will benefit both from some, you know, initial funding to help, you know, with some of the implementation activities or planning activities, and also from some TA and training support and being able to connect with peers during this 24-month period.
Great, thank you, Andrew. Carol Priest asked, does the funding have to be distributed equally over the 2 years? And the answer is no, that it's how you want to build this out, right? Like, so you might have a kind of a, for use of a better, lack of a better term, like an onboarding kind of in the first, maybe the first year where things, you don't have as many people involved, or maybe at the beginning you have a lot more people involved and people taper off as your intervention gets going. So no, you can make your funding look however you need to make it look to do what you want it to do. And then Carol, your other question is great. Also, do you have a definition or guidelines for families at high risk of child welfare involvement? And I think the question, we actually have this answer to this started in our FAQ document. And let me get there so I can read this aloud to you already. Let's see. So I think for us, the minimum is for families that you're working with, families must be at a minimum at risk of child welfare involvement and experiencing housing instability. So that can be, you know, as you think about those families who are at risk of child welfare involvement, that can be families who are experiencing poverty and housing instability. That can be justice systems involved families, families experiencing or fleeing from domestic violence, families who have a parent or guardian with high health or behavioral health needs, or maybe a confluence of all of those things. All those, as you think about and look at the data for your area of who are the folks that are most at risk of child welfare involvement that end up coming into your system, that's where I would focus that at risk piece. But Teresa, Andrew, others jump in here on that.
I would add one piece. I agree, and I would add one piece, which is, you know, as states have been doing a lot of work over the last several years, especially with the passage of the Family First Prevention Services Act, and states have been putting together and submitting plans, prevention plans. And within those, there's candidacy for foster care definitions, which is really kind of candidacy for out-of-home placement. And so that's probably one consideration to look at. But I think within this work, thinking, there's a lot of room to think even more broadly than that, as far as not just out-of-home placement, but even you can think upstream from child welfare, to begin with, but still thinking about those factors that put families at risk of coming through the front door, as well as can include those that are in that candidacy for foster care definition. So we're trying to, I think, leave room to really align with where your jurisdictions are going, and to really think about truly what's it going to take, and who are the families that are really disproportionately impacted and most at risk or currently impacted by the housing instability and child welfare pieces.
Allison Moon asks, will the TA provided offer support for best practices and training for organizations in including families with lived experience as co-creators, or will applicants need to come in with that expertise? That's a great question, Allison. And as you've noticed throughout all of this, we are really looking for people to come in as applicants and include families with lived experience. I think we have a co-design report that you can access about how to meaningfully include families with lived experience. That's in the RFP. It's on our website. If you can't find it, let us know. We will absolutely send it to you. And there's members of our CSH team who are super well versed in how to really meaningfully include families with lived experience, and can help you kind of think through how to do that if you want to ask some questions about that as you're thinking through your application. And Laura just put the co-design report right in the chat, so there you've got it. Do read through that and let us know if you have questions after that. Great. Well, thanks everybody for coming and being a part of this webinar. We really appreciate you taking the time, and as noted before, this has been recorded. It will be up on our website on the RFP landing page. We'll also be updating our FAQs with all the great questions that were asked today. Thank you for all of those. And if you have any more, please send them to us through the One Roof email, and we'll make sure to answer them as quickly as we can. Thanks, everybody. And there's the One Roof email in the chat, just to remind you of what that is. Thank you, Leah, for putting that in there. Wonderful. Thanks, everyone. We really appreciate it. Looking forward to hearing all the awesome ideas you're thinking about and reading about them.
Amy, one more quick question.
Oh, yes.
Are there character or word limits?
Yes. Let me, I'm going to remind myself of that one. There were in the past, and I think there still are. We try to be mindful of wanting to give people enough space to write what they needed to write, and mindful of the fact that we're going to have to be reading through all of these. So yes, there are character and word limits, and those are very plainly stated in the application. So you'll know what you're working with for each question in the application. All right. Thanks, everybody.
Thank you.
Thanks, everyone.